Welcome back, everybody, friends, colleagues, guests, to Designing on the Front Lines. This is the hour and art. Thanks, Rob. I am your host, Morgan Hutchinson, and I'm here coming from the emergency department at Thomas Jefferson University. And I'm here joined with my whole team from the Health Design Lab. Misty Shine, Michelle Ho, Marion Daly, and of course, you know, our friendly producer and Zoom bouncer, Rob Puglisi, my co-host, Matt Fields, and our Design Lab director, Bon Coop. We are also joined by our friends at Cooper Hewitt and the Smithsonian Museum, including designer, writer, and curator Ellen Lupton. Please remember to turn on your video, use the chat box to introduce yourself, tell us a little bit about yourself, and of course, as always, feel free to join us in an optional happy hour drink. If you missed any of our prior episodes, you can check them out on healthdesignlab.com/DOTFL. Nurses are truly frontline workers. Today, we are lucky to have two nurses here as speakers. We have Marion Leary, who's joining us from University of Pennsylvania in Philadelphia, and Ashley Howell, who is our colleague in the emergency department at Thomas Jefferson University. Following these two speakers, we have Bryan Lee, who's an architect and designer coming from New Orleans. Each speaker has about 5 minutes to speak, and we will also have 2 5-minute breakout rooms for you.
Cool. Is it my turn, Morgan?
All you.
All right. So, for those of us who have been working in emergency rooms and hospitals and taking care of patients, we know that coronavirus has disproportionately killed people of color in our country. Black Americans are 2 times as likely to die from COVID-19 as white Americans. In some areas of our country, it's even as high as 3 times. And the health disparities in COVID-19 are not due to genetics, but rather it's due to decades of racist policies in our country. Racist policies have led to higher rates of chronic health conditions like asthma, COPD, diabetes, obesity, kidney disease in communities of color. And unfortunately, these conditions are risk factors for COVID-19. So when we think about ending these health disparities in this current pandemic, it's critical for us to keep in mind of designing for social justice. We believe that racism is a public health emergency, and designing solutions for COVID-19, we need to keep aware of these issues and address the current racist policies that exist. So it's been a tough week for us here in this country, and we are just kind of grateful that you're able to join us, and want to kick it off to Matt Fields, who will introduce our first guest.
All right, thank you, Bon, and thank you for that. I am really excited to introduce someone I first crossed paths with probably 10 years ago at the University of Pennsylvania when she was doing some pioneering work in resuscitation. Since then, Marion Leary has become an all-star at the crossroad of nursing and innovation, and in design thinking, and she's the director of innovation for the School of Nursing. She's done some really cool stuff like founding Emerge Labs, which uses augmented and virtual reality platforms to reimagine how we prepare for emergencies. And in 2007, Marion Leary was named Philadelphia's Geek of the Year by Geekadelphia, Generosity, and technically PHL. And, when I was growing up, being geek wasn't cool, but now it's like the best thing. It's the greatest title you can ever get. So that's so awesome. She's also a host of Steam Rollers, a segment of the Steam Everyday podcast featuring women who are paving the way in science, technology, engineering, art, and math. So Marion, it's awesome to have you here with us. Thanks for coming.
Hey everyone, thank you for having me. I'm gonna just pull up my slides. Can you all see those?
Yep.
Great. So Matt, thank you for introducing me. Being 2017, Philadelphia's 2017 Geek of the Year was actually one of the best titles and awards I will ever get. So thanks for mentioning that. Like Matt said, I am the Director of Innovation at the University of Pennsylvania School of Nursing. I'm also a founding member of the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. And I bring that up because what I'm going to be briefly talking about today is the work that we did during COVID-19 around hacking for health. So 2 weekends ago, we led the Designing the Future Nurse Hack for Health hackathon, looking at COVID-19. And we did this in partnership with Johnson & Johnson and Microsoft and DevUp. So the four companies worked together on this weekend-long nurse-led hackathon. And the idea is that we wanted to have not just nurses, though it was focused for nurses, but we wanted to have engineers, designers, innovators, entrepreneurs, physicians, pharmacists, whoever was interested, come together for a weekend and create solutions to problems that our nurse clinicians were seeing on the front lines during this pandemic. And we had over 500 participants work through the weekend. We had over 30 teams pitch solutions at the end of that weekend in 5 different challenge areas. So we looked at remote patient monitoring in the acute care setting, remote patient monitoring in the home care setting, patient transfer, handoff and huddle, data and reporting, and resiliency and self-care. And those were the 5 areas we really wanted the nurses to design innovative solutions around. But we wanted to build a foundation for the nurses to understand how to get from a problem all the way through to a solution. And in partnership with IDEO, so we had 2 speakers from IDEO, which is a big design thinking firm, who did lectures on the Wednesday before the hackathon and then during our Friday night virtual kickoff around using design thinking and innovation to respond to COVID-19. And this set the framework of design thinking, going from empathy, define, ideate, prototype, and test. And then we also included a number of different resources for all of our participants around design thinking as well. So we really wanted to give them this foundation to use throughout the weekend. And one of the resources that we gave them, so at Penn Nursing, we created the Design Thinking for Health platform, which is an open access free curriculum that nurses can use to design solutions to problems they're seeing every day in their practice. And so we let them go onto this website, go through the curriculum. Dr. Von Koo is one of the lecturers on this online open access platform. So we created 4 documentary videos, 6 original lecture videos, and some podcasts. And we also have design thinking resources activities. And these were all used during the virtual hackathon to allow these nurses to work through the human-centered design process. And so I'm just going to quickly walk through some of the examples of what our teams and participants in the hackathon did using design thinking to help them get to their end solution. So obviously, first step in design thinking is empathy. And because this was a virtual hackathon, the nurses used a lot of social media to do interviews and to try and find key stakeholders to talk with and to learn about their experiences. Also, because we had over 500 participants, most of whom were clinicians, they were able to take the experience, the collective experience of the group, and really take the observations from those colleagues to understand these different problems that they were trying to solve for. Some teams were looking at how to use school nurses for contact tracing. Some teams were looking at how to decrease exposure to COVID-19 during acute incidences in the hospital. Some folks were trying to figure out how to keep morale and resiliency up in their colleagues and coworkers. And all this came out by talking and using the empathy activities in design thinking. These 2 teams here use journey mapping, but a number of other resources and design thinking activities were used as well. We had teams obviously then go through and define what their problems were. Again, I just mentioned some of those problems, so I won't belabor this section, but you know, there were a lot of teams working on different platforms to think about what the problem statements were, think about the problem from the point of view of the different stakeholders who they were designing for during this hackathon. And that could have been clinicians, but it also could have been patients. It could have been community members. It really ran the gamut of the spectrum. And then for ideation, we had some of the teams that were using, it's like, it's not like. I like down here, one of the teams was looking at it. This may or may not age me, but the old Microsoft Word paperclip that used to pop up when Microsoft first came out, looking at whatever that team was thinking of for a solution. Was it like that Microsoft paperclip, and how could they build on what was already existing and using it in a different way in the solution that they were creating? We did have a number of teams create working prototypes. So the idea with this hackathon was really, we didn't want a hackathon for a hackathon's sake. We really wanted the teams, and we stressed to the teams that the solutions that they came up with needed to get out to the clinicians as quickly as possible after the hackathon was over. And so these were tech-based solutions that we were asking teams to create. And also, I failed to mention, these were open access solutions. So whatever was designed during the hackathon is open source and was put on GitHub. So any healthcare system, provider, community group that has a need for these can go in there and grab the code and build upon it. So we had teams, again, building out these prototypes over the weekend and also testing them. I'll move back, prototyping real quick. This team was looking at a patient augmented reality information system that you could use in the patient's room, so you wouldn't have to bring different charts in or other computers into the room, that you could just see everything you needed to see using augmented reality. Additionally, we had a team who was looking at resiliency and built out an app that they tested over the weekend as well. Part of design thinking is being able to storytell and to pitch your solution. And we did have a number, like I said, we had over 30 teams who were pitching to a number of different judges from around the world. We had judges who were physicians, designers, entrepreneurs, CIOs, CEOs. And so at the end of the weekend, folks pitched. We picked winners. These are our 5 winners from those 5 different areas. They're now going to move on to get 3 months of mentorship from Microsoft, Johnson & Johnson, and SunCL to continue building out their solutions. And again, these were focused on COVID-19 for clinicians at the bedside and out in the community to really help solve the problems that they're seeing during this pandemic. The hackathon was a huge success. Of all the surveys we got back, the nurses were really excited to learn more about design thinking. As somebody who's been working in this area for a couple years now, to really see design thinking come from sort of obscurity in nursing to where people in the profession are really looking for more resources and interaction with this methodology has been really great to see. And this was definitely highlighted during this COVID-19 virtual hackathon. If anybody's interested in seeing how the weekend played out, we put together a transcript of the Twitter hashtag on WACLIT that you can access here. And we also have the winning pitches. We video recorded them all, so those can be accessed through the Microsoft telecommunity as well. And with that, I will wait for questions or see how this plays out.
Awesome, Marion. Thank you so much. That was a great presentation, and perfect timing, because I know that we were discussing strategies to approach a hackathon virtually, and so glad to see that you have done it. And it sounds like it is a very viable thing to do. And I was actually kind of, is there actually maybe even like advantages to doing it virtually that you didn't anticipate?
Totally. It was so super successful. I've been on some virtual hackathons during the COVID-19 that weren't as successful. I'm not just saying that because I was involved with it, but there's definitely pluses and minuses. Pluses being that we had people from all over the world. I mean, this was a global hackathon who otherwise would not have been able to participate. And I think a lot of the nursing hackathons I've been to in the past were not as heavy on programmers and designers, whereas this one, I think because it was virtual, the programmers and designers didn't have to leave their homes.
Okay.
we really had a lot more engagement from those professions as well. So definitely pluses and minuses. All of our participants said they felt equally as engaged as if we had been there in person. So I'd be happy to talk through, Matt, how that worked, at some point.
Yeah, I'm very interested. I'm sure a lot of other people will be too. Well, thank you, Marion. So that was excellent. I'm going to go ahead and kick it back over to Morgan because I think she's going to take us to some breakout rooms maybe. So go ahead, Morgan.
Absolutely. Thank you so much, Marion. It is time for our first breakout room. So rules for the breakout room, we're going to randomly assign you all into groups of 4 to 6 people. This is a time for you all to connect and introduce yourself to each other. Tell us who you are, where you're from, what kind of work you do. And for our prompt for this breakout room, we're going to ask you, what has been your favorite way to stay connected with your community during the COVID-19 pandemic? Welcome back, everybody. Oh, those breakout rooms go by so quickly. It's nice to meet everybody with Kathy and Ashlyn and Ram and everyone. And we have people calling in from Chicago and from Arizona, and I know from all over the world as well. It's great to talk to you guys. So I'd like to go ahead and introduce our second speaker, Ashley Howell, who is a friend of ours and a colleague of ours. She is an emergency medicine nurse at Thomas Jefferson University, where many of us in the Health Design Lab also work. And then Ashley, I think I'll share my screen, right?
Okay, sounds good.
Cool. Just have to figure that out.
So I'll get started. Hi, I'm Ashley. I'm a registered nurse that works in the emergency department along with Morgan, Bon, and also Matt in the emergency room in Center City. I've been at Jefferson for about a year now. Before I was at Hahnemann, which was one of our other inner city hospitals that unfortunately closed down last year. There I worked as an ICU nurse, and now I am here working at Jeff with my new family, and I am honored and proud to be here. So this year has turned our world upside down, first starting with COVID-19. I remember looking back, this is me actually leaving out of a patient who we were treating for COVID-19 and basically give an example of how we have our PAPRs on and how we sterilize ourselves after we leave a room, make sure that we're thoroughly wiped down. And I just posted this on my social media. Before we enter a room, we have to PAPR up, gown up, make sure that we're changing our gloves, wearing our masks. These are just a group of my colleagues and just amazing group of people that we've worked with throughout this crisis that has affected all of us worldwide. Either we know someone who has had it, we've had it ourselves, or we've taken care of it, of someone diagnosed, someone who has recovered from COVID-19 or has had, unfortunately, not survived from COVID-19. This has been a worldwide crisis. And I feel like as a nurse, not only as a nurse, but also an African-American nurse, I have another crisis that I'm also fighting for, which is obviously the Black Lives Matter movement. This last week has been really hard, I think, for everyone, not only including, dealing with COVID-19 and like being on lockdown and not being connected to my family and friends, but also dealing with this and also understanding the movement and dealing with it firsthand. So I felt that it was important this time to not only stand up and voice what I feel as a Black African-American nurse and stand up for what is something that's also really important to me, and this is the Black Lives Matter movement. Right here, I had so far attended 3 protests in Philadelphia. The first one I attended was Saturday, which I know we got slammed in the ED, so I've heard. So I just wanted to share some pictures as far as how we've been, as a community, helping people and the protesters during this time as they're marching around Center City. So to the left of you, there's 2 medics. So in their bags, they had gloves, they had alcohol swabs, they had scissors, they had anything, first aid that anyone would need just in case any of us got injured. I also saw a number of people handing out milk, which is what protesters use whenever we are tear gas, pepper sprayed by police officers when they're attempting to de-escalate, which I feel that has been mostly peaceful protests, all the ones that I have attended and saw. On the right side, I just had to take a picture of this young man who was walking with us. And this was yesterday. He said, I can't see what it says, we are essential workers ending racism. And this is what exactly is important to me. Like I had posted a video on social media when I just was very compelled to feel like I needed to speak out, not only for my family, but also use my social media platform to be a voice to my community, and also as a registered nurse on how we can help these people. And also wanting to show how the protests have been peaceful. And ironically, as COVID-19 has affected us worldwide, I feel like this has also affected the whole entire world. It's been a ripple effect. To see so many people of all walks of life, all religions, come together as one. As you notice, like, many people are wearing masks. I saw people handing out hand sanitizers, gloves. We also were making sure that we were staying safe while we were protesting, which was extremely important. And I'm so glad that I was able to capture that on film. That video right there is actually more protesters that are joining the protest that I was in. They were actually coming up from, I believe, Broad Street. And we just all started clapping once we saw them. And right there at that location is Love Park that we are at. So this was me, and to the right of me, or my left, is my coworker. His name is Jackson. He is a daytime tech at the emergency room. So that is the sign that is very true to me that I made before I went out on that protest, and it speaks from the heart. I am, at the end of the day, when I take off my scrubs, my stethoscope, clock out at the end of my shift, you know, I still am a Black woman living in America. So this movement is something that affects me, my family, and is important to me. And at the end of the day, we are all coming together as one, fighting for humanity, human rights. And to see people from all walks of life, I've seen people protesting in Israel, Palestine, Italy, France, Jamaica. All the states have been participating, so it's amazing. To the left is another coworker. Her name's Anna. She's amazing. She's also another emergency room nurse, and that was us protesting yesterday, walking to the art museum. To the right, that was the first protest I went to, and I had took that picture. It's for, I believe that they're residents. I'm not sure where they are working, and I saw them. And as I was protesting, and I was walking, and I had to capture this picture because at the end of the day, as healthcare providers, as frontline workers, we are here to treat, we support each other, we want to provide service and aid to patients of all walks of life, sick, dying, healthy, rich, poor, doesn't matter. So the fact that these 4 healthcare providers came out either beginning of their shift, after their shift, they felt that it was important to speak up and also take a stance on what they believe in, because at the end of the day, it's humanity that we're standing up for it. And sadly, it's not just one incident that happened last week with Mr. George Floyd. Unfortunately, it's a pattern that I've seen, unfortunately, a lot of times. But I just had to take this picture, and it just speaks volumes. And to see so many people get together during this crisis, during COVID-19, was just such inspirational for me. And I think I've tried to see the positivity throughout this. So I think me going out to protest along with my coworkers has really helped me see the light in the community that we've all been gathering for and coming together to stand up for the rights of humanity.
Thank you so much, Ashley. It's an honor to have you here, and thank you so much for sharing those photos and the experience that you've had and your perspective. It's very, very wonderful.
Thank you.
Let me see. And
there's a Morgan, there's a great question from Colleen. It says,
oh,
do you feel like, and so this is for Ashley, do you feel like racism is talked about in healthcare settings, especially from hospital leadership?
From my own experience, I don't. I don't believe it's talked about enough. I will say from my own personal perspective, I know that something like this is, as far as racism, can be uncomfortable for people to talk about and to have an open discussion, because we have so many people that have different views. Like one of the things I had said on one of my videos is it's very hard to see another person's perspective, which is understandable when you don't live it every day. I don't believe it's talked about enough in healthcare. I hope that eventually we can talk about this more fluidly, and understand that there's many people that can agree to disagree on certain things. But I feel like certain people may stay away from that subject because it makes them uncomfortable. But I personally don't feel like it's talked about enough.
thank you, Ashley. I'll turn it over to our director, Bonku, who will be introducing our next speaker.
Yeah, thanks, Ashley, and really honored to have Bryan Lee here. I first met Bryan at South by Southwest, or actually, I don't think I met, well, I kind of met you. I was more just like in the audience listening to you speak about design justice, and it really, really blew me away. Bryan Lee, he wrote an article called American Cities Were Designed to Oppress, and that's in City Lab. I'll share the link in the chat box. Bryan is he's a designer. He's a director of Collate Design. In 2018, Fast Company voted him as one of the most creative people, which is pretty cool. But I've been a big fan because of his views on design justice. And I think his message is an important one during this time. And it applies not only to our current state in this country, but in healthcare as well. So thank you, Bryan, for joining us this week. And I'll hand it over to you.
Yeah, thank you. Thank you. I appreciate everybody having me today. You know, it's been a long week. It's been a long month. It's been a long year, decade, century. When you have to deal with things that are so ingrained into the system that they affect you at a cellular level, right? I know that's a metaphor. It's not a real thing. I know it's a bunch of doctors and nurses on here. I know I'm not gonna don't fact check me on that, but it is. It's a deep, abiding thing that challenges and changes how we operate and move in the world. And so, you know, we abide by this core concept that for nearly every injustice in this world, there is an architecture that has been designed to sustain and perpetuate it, right? This idea that our values are validated in the spaces and places that we design, and thusly, when our neighborhoods are sick, our people become sick, right? Everyone knows this, right? The sign that Ashley just showed, you know, racism as a public health crisis is so embedded not just in the air in our cities, the way in which we construct those places add to that issue. One of the things that often happens for us when we are doing this work on a day in, day out basis, we talk about gentrification. We talk about its role in fragmenting communities and thusly making those communities less likely to connect with one another, less likely to be active outside of the home, less likely to take care of each other, and then more likely to be sick because of it, right, in various ways. And so it's critical that we see this as both the acute and the obtuse kind of conditions that they are, and address both with the same vigor. You know, we often point to the fact that you know, the issues that are harmful in our communities, oftentimes the frontline workers are the ones that have to deal with those kind of fires, whether small or large, you're dealing with something immediate. And it's why there are TV shows about cops and TV shows about doctors, because it's immediate. There aren't TV shows about architects because it takes us 5 years to do anything, right? But if you think about the destructiveness of certain acts, the things that y'all deal with are these small fires, but think about architecture as kind of raging waters, right? Like it is longer term, it is omnipresent, it is still as destructive as anything else in this world, and we have to balance those elements enough to find some sort of healing through that process. And so I will say, our work in the last month, since we started to re-up our drive around Black Lives Matters in this last series of protests, has been to organize thousands of designers across the country around an action call. And that action call is to dismantle the institutions and systems that maintain architecture and planning as a tool for that oppression. And a way for us to do that is by, in part, doing what BLM has asked us to kind of forward in this world, which is how do we defund police departments that usually eat up between 35 and 50% of our budgets in cities, and invest in the cultural spaces in communities, the hospitals and clinics in communities, the things that actually secure and sustain community in a real way. We talk about community and neighborhood as body and soul in a lot of ways. So neighborhood being the kind of geographic boundary that sustains a place, or that gives you the meat of a place, but the community is the soul. It is this thing that has a affinity to the body, but is not conscribed to it. It can float outside. It can be detached in some places, in some ways. And so we have to be very careful to maintain that affinity as best we can. And so our job this last month is to really channel the thousands of people who have joined this cause, and find ways to address not just the murder of Black people by way of state-sanctioned violence, but the murder of Black people by way of neglect, and that often happens in healthcare more than happens anywhere else. And so, I think about the mortality rates of Black women. I think about the lack of concern oftentimes for Black and brown youth when they're trying to find healthy alternatives in their lives, and I'm hoping that the connections that y'all have made and y'all are continuing to make, that I can join, and that I can marshal the folks that we have to join in this fight and be supportive in the recovery of our immediate conditions, but I think long term, how can we stay connected so that the work that you're doing at the Design Lab is a part of what Design Justice does moving forward.
Great. Thanks, Bryan. I think we have maybe sometimes if you want to ask Bryan some questions on the chat, I'd like to, I like this point about dismantling institutions, and I think really, and I saw some on the chat too, that we talk about structural, we talk about social determinants of health and how they impact overall health outcomes. But I think there's been a little discomfort of just calling out racism as the cause of decades of policies that have impacted brown and Black people in our country, and have set up the conditions for communities of color to have worse health outcomes. And we know that place where you live is probably the most important factor in how healthy you're going to be, because where you live determines how good your school district is, if you have access to food, if you have access to healthcare. So I think there seems like there's a time now that we can just call it out for what it is. That decades of racist policy have impacted the health outcomes of communities of color in our country. And I'm wondering, like, any advice to us in the medical field of what we can do to address this?
You know, the biggest thing that I could ask you to do is to marshal the weight of the medical field to pressure architecture, right? Like, we respect the medical field. We know like what it takes to go through years and years of training and years of licensing to become a person that could barely do the job that we thought we wanted to do. Like, we're still always learning, right? And I think the medical profession can be more declarative about the social determinants of health in a way that starts to pinpoint how the architecture can start causes a lot of these issues. And I think in part it helps because we think about how zoning became established within the United States. We think about how redlining has impacted the distribution of resources in the United States. And all of those things start to chip away at the health of those communities. So marshaling the institutions within the AMA to be a sledgehammer against other institutions that are not going to change otherwise.
And there's a question from Ellen Lupton. She says, how will designers contribute to dismantling the police system?
Yeah. So the big things would be so the way that we think about dismantling the police system is to dismantle the parts of the institutions. So, for instance, the AIA has a justice track where they give honors and awards, and they have a massive system to support that track. So detangling ourselves from that, detangling ourselves from the causes of CPTED, which is crime prevention through environmental design. One of the things that I wrote in the article is that architecture serves as the soft power to police power, right? Like, it is the warning shot before police are called. And the way that we design spaces makes it intentionally a warning shot. And so I think we should detangle ourselves from the actions of defensible space and crime prevention through environmental design. And we should remove all officers and cops from the design process completely. Like, there's no reason an officer should tell us what should be happening within the frame of a building.
And there's some data I saw on, we see these police in full-on protective gear, and I think it's maybe about $800, $900 to outfit that riot police. And then there was a picture next of a healthcare worker, and it's like $8 to fund a healthcare worker. So I think we talk about, when we talk about racist policies, then we have to think about how much in communities does that budget go to funding the police versus funding schools, education, for funding hospitals. And these are really kind of tangible ways of how we can kind of call out some of the racist policies around funding and overfunding of the police system, and maybe underfunding of education and health and workforce development in communities that have kind of created these like conditions.
Yeah, absolutely. I think lastly, before I have to shoo off, I just want to say, again, I think about how our policies are often centered on whiteness, and they define like status quo by that definition. So we think about single-use zoning or single-use housing that is proliferate across the United States is not necessarily a condition that collective or cultural communities want to endure. We actually enjoy congregating. It is part of our very kind of essence. And so when we think about zoning policies that detach us from one another, takes away from our psychological health, but ultimately it means that we have less interactions with one another, which means that it takes away from our physical health as well. And so we have to think about not just the singular moments, but the collection of rules and policies that have been implemented over time that culturally define how we exist in this country, but are not necessarily the way that communities of color operate.
All right. Thanks, Bryan. And I think I'm gonna kick it off to, is it Morgan or Matt for
It's
our
me.
next part? Okay.
Thank you
great.
so much, Bryan. We're very lucky to have you here. I really appreciate your perspective and your presentation just now. So we are now going to go into our second and final breakout room for the day. Just as a reminder, introduce yourself, tell us where you're from, tell us what you do. And for our prompt for this breakout room, it's going to be 5 minutes. What have you been doing to stay well during the COVID-19 pandemic? Rob, I will give it to you to put everybody in some breakouts. When
All
we
right,
come
I'll
back,
send everybody
we'll
on
try
their
to get to
way.
a couple questions.
All right, everybody. See you soon.
I had another great breakout room. I don't know about the rest of you guys. I think that we all did. But the interesting thing in my room is that I haven't had two people from the same place. It's so great to meet all of you guys from all over the world, all over the country, from all kinds of backgrounds and specialties and careers. And it's just really nice to meet all of you. And we've gotten great feedback from that. Hope you like the prompts. Feel free to send us ideas for next week. And I think that we have a couple more questions. We did get a lot of questions this week for our speakers, and we have a few more minutes. So I will, along with Matt and Bon, go ahead and ask a couple of those questions. Bon, did you have any of these that you want to start with?
Marion's hackathon, what are one of the great ideas that came up?
So there were a ton of great ideas. It's hard to pick one. I will say one of the ones that I thought would be most useful right now is it was looking at utilizing student nurses in public schools as contact tracers. So as schools are starting to try and figure out how they're possibly going to bring students back socially distancing and safe, they also need to figure out how they're going to contact trace and monitor. And school nurses who are in, or students in nursing school, they have a lot of community clinical hours they need to do as well. And so somehow the idea was that they would use technology to match the nursing students with nursing schools, and also then use sort of RFID tracking for contact tracing. I don't know exactly the details of it. I was not a judge on that one. But I thought that was really important because it is going to be, I think, something that is going to be at the forefront while schools start to think about reopening. And I'm going to post in the chat if anybody wants to watch the videos of the pitch, all of our teams pitched. You can go to our website and check those out.
And there's a question from, we probably have the last one, Stesha. For Bryan, do you have any examples of ways we can repurpose already established buildings or maybe spaces to design spaces for justice?
Sorry, on mute. Yeah, I think that the best way to think about that is the amount of square footage that you have that's lost to storefronts, to ground level spaces. I would say start there, because those are the spaces that actually start to connect communities back together, start to weave people back together. And so I'd say start there with civic, cultural, and communal opportunities for people to gather on a consistent basis, whether that's to shop, to eat, to love on one another. I mean, like, whatever the thing is, we want to be able to enjoy the glow of our relationships in those spaces.
Thank you so much, Bryan. It's great to hear from you. It's really great to hear from all of our speakers. Thank you, Marion, Ashley, Bryan. This has been an awesome week and a great conversation and 2 excellent breakout rooms. I would like to let you all know about our speakers for next week. We have Dr. Aditi Joshi, who's a director of Jeff Connect at Jefferson's Telehealth, Dr. Sheila Sani, who's an interventional cardiologist in New Jersey, and one of the stars of Chasing the Cure with our own Bon Ku, and designer George I, who is the co-founder and director of innovation for the Greater Good Studio. It's going to be a great week, and we hope to see you guys all back there. We shall let you go, Rob. Go for it. Thank you.
All right. Have a good one. Thank you.
Bye, guys.